Good afternoon, everybody, and just wanted to point out the chemistry, bioavailability, fate, and transport of contaminants in soil, which is the title that our group has come up with here. It's really exciting to be here today. I've been interested in this topic, worked on this topic in various ways, shapes, and forms through groups like the Soil Science Society of America for over a decade now. But I've been to a lot of meetings where we talk about this, but I'm always talking to other soil scientists and agronomists and maybe a random geologist or geographer tossed into the mix, and the chance to be in the room with people that are from other aspects of this topic and have interest from that more of the human health side is really fantastic, because I look at this, I'm interested in it, I want to see it move forward, but I have zero formal training in human health or the human organism. That's more of it's an interest of mine as one, but it's really great to be here with people who do have that formal training. So. As I go through here, my approach to getting things introduced here, just to kind of step through a couple, we have 4 different speakers here, 4 different aspects of contaminants in soil, and I'm just going to kind of step through a little bit of each of those different aspects and why it is that those aspects are important to us. We have heavy metals that we end up with in our soils, and some people feel that heavy metals may in fact be the oldest global soil contamination problem that we face. This is another one of my hobbies, is history of soil science, so something I play with quite frequently. But we go all the way back to the Greeks and the Romans, and we can look at sediments and ice cores and such from this period of history, and we find evidence of widespread aerosols containing heavy metals within them. From this time period. So we've dealt with this for a long time, not necessarily always aware of it, but have certainly had it around. And there's a wide range of health effects that are associated with heavy metal exposure. Now, of course, we talk about soils, whether or not heavy metals in soils cause a problem depend on a lot of different aspects of that soil. The bioavailability, which is related to soil chemistry and such. You can see just got a little table up there that has a few of the heavy metals listed, some of the health impacts that go along with those. We have central nervous system problems, all kinds of problems that can arise with various organs within the body. Cancer can be a problem, so on and so forth. So the heavy metals are definitely something that we become concerned about if they're present in the environment in high amounts. We oftentimes do group arsenic in with the heavy metals, although technically arsenic itself is a metalloid, not a heavy metal. And there's a lot of ways these metals get introduced into our environment. We have the burning of fossil fuels. I always find it very interesting. I'll talk to my students and we mention metals and burning of coal, for example, in the same sentence, and it blows their minds. What do heavy metals have to do with coal? Right? Well, scientifically, we know this. In terms of the general public, this message doesn't get out. Much of our world is not aware of these types of associations. And of course, if you're downwind from a coal generated power plant, you end up with these metals in the soil in that downwind area. We've also, another thing that a lot of people don't think about is metal contamination in agricultural soils. But we have added metals through fertilization. We fertilize to make the soil environment better for crop production, right? That's kind of the concept behind fertilization. But there are metals that are contained in the raw products that are made or that are used to make many of our fertilizers, our salt-based fertilizers. Or we've had situations, there's a big thing, it was 1990s if I remember right, but a big situation out in the state of Washington where they were adding heavy metals to the filler in fertilizer as a way of disposing of the heavy metals. Let's spread them on the fields, okay? There's no regulation on the filler in fertilizer, at least at the time there wasn't. Only regulation on the nutrient content of the fertilizer. So instead of paying to dispose of these waste products, we can have the farmers pay us to spread them. We've had a number of different issues that go along with heavy metals, and that, now Washington does have laws in place that govern those fillers, but this was an issue not so long ago. We tend to think of soil nutrients as being a good thing. They are a good thing, right? We have to have nitrogen, we have to have iron, we have to have selenium in our diets, and our source of these nutrients like this, is the soil, okay, the nutrient content found in those soils. But these nutrients, they're a good thing in the proper quantities in our soils. Okay. We have too much nitrogen. End up with nitrogen leaching into our water systems or being eroded into our water systems. And now we have health impacts with that. We have nitrogen standards for water because of the health impacts. Over-fertilization is one major way that we end up with excess nitrogen in those water systems. Iron was mentioned earlier today. We have a major problem worldwide with iron deficiency. That's absolutely the case. But excessive iron in the diet can also cause problems. Now, this is probably not a major issue with most of our soils, but there are some places where perhaps it is. Okay, we want the right amount, not too much. Selenium, one of these trace elements that is essential to human health, but not enough causes big problems, too much causes big problems, and the difference between not enough and too much can be really, really narrow with something like selenium. Okay? And there are many places in the world where we have selenium deficiencies, but there are also several places in the world where we have selenium excess in soils, and we have health effects, negative health effects that go both directions with those. So nutrients, and in particular our nutrient balance, is very important from a human health perspective. Okay. Organic chemicals, something that has become a very widely used products in our modern world, especially as we look in the kind of the post-World War eras of the 20th century, and we see a lot of organics that come into our modern agriculture, our modern industry, things like this. We have these organics. Industrial activities are a big source. Fossil fuel combustion is a big source. Improper disposal of waste products. Sewage can be a big source of these organic chemicals. Medications and combustion of medical wastes. Okay. It's amazing some of the things that are meant to be good for us and that are good for us, but if they're not handled properly, not disposed of properly, they become problems rather than benefits. Application of pesticides to crops, certainly a major issue. We got a couple of pictures here. We've got a farmer out with his tractor applying pesticides to a crop. We've got a worker there spraying pesticides, organic pesticides. It's interesting. You probably can't see it just from size, the size of the picture, but if you can zoom into that lower picture, that worker has one of those really cheap, like painting masks on his face. Okay, probably not adequate protective cover in this particular instance, but exposure of workers who handle these chemicals has been a really, really big issue. And of course, you look around at our farming communities, and we have some very high rates of things like cancers, amongst farmers as an occupation, probably linked back in many cases to exposures to these chemicals that they work with. Within the world today, we do have the Stockholm Convention. I published a paper just a couple of years ago, or I guess after it got published earlier this year, I wrote it a couple of years ago. This takes time sometimes to get them out. And at that point in time, there were 26 chemicals that were on that list. We put a table in the paper of the 26 chemicals that are overseen by the Stockholm Convention. Not all of them are banned. Some of them they simply look to limit their use, but the 26 chemicals, I went and counted as I was getting prepped for this. I went and counted a few days ago, and if I did my counting right, in my hurry to get my presentation put together, we're up to 33. Originally it was 12 when it first came out. So we're always finding chemicals, new, not necessarily new chemicals in the sense that they haven't been around for a long time, but always finding new problems with these organic chemicals that lead to greater regulation of what's out there. And probably one of the newest problems that we face in the modern world is the nanoparticles. At least one of the newest problems in terms of what we're aware of how we follow through things. There are both natural and manufactured nanoparticles that are found within our environment, used in lots of different places. Again, a very common thing in our modern world, in products that people are using every day. With the nanoparticles, one of the interesting problems that we have is simply the measurement of these nanoparticles. Having an appropriate standards to figure out exactly what's there. We also have issues in terms of understanding what exactly the problem is with many of these nanoparticles. We have metal nanoparticles, for example. If they're causing health problems, is the problem the exposure to the metal, or is the problem the exposure to this very tiny particle and the issues that something of that size creates? Or is it perhaps a combination of those two things? So these are some of the things, these are the different things that our panelists up here today will be talking to you about. Like I said, a group of experts that'll address various aspects of these four areas and give us more insight into the current state of the art and knowledge in these areas. Now, as we look at some of the issues that are involved within this topic, and a lot of this will repeat things that have been said already today, which is both, as you're sitting there watching the others go up, you're thinking, oh, I got that in my slides too. But on the other hand, you're going, hey, other people are thinking the same thing, as far as where we need to go with many of these things. But my first one there, notice I got education, I got it underlined. Okay. We have a major disconnect in today's world between the majority of our population and soil. Soil from a supply of food perspective, soil from an exposure, health impact perspective, just soil in general. We've heard it said already today, very, very important to us. And yet, most people associate soil only with rather negative connotations. Remember when David's book, Dirt, came out, and there were a lot of soil scientists saying, it's a good book, it's a rather unfortunate title. Dirt. But that's the concept, that's the perspective that a lot of people have on soil. It's dirt. And you get these negative connotations. We need to really work on changing that. Behavior of many of these things in the soil environment, organic chemicals, metals, etc. They're in there. We know they're there. What exactly they're doing, what that means from a human health perspective, that's something that we don't really understand. I got somebody involved. He's in the room now. I've said this at previous meetings. He's never been there before when I've said this. Toxicologist. I got him involved in this a few years ago, this whole soil human health area of interest. And he started looking through papers, and he came into my office one day and says, you know what? Because you soil scientists are really good at knowing what's in your soil. You got no idea what it means. That's something we got to work on. Soil's a really complex environment, a lot of different chemical mixes out there. We don't just have individual compounds. What an individual compound means from a human health perspective is not necessarily relevant to what a mixture means to human health perspectives. This is a big need. Contaminant pathways, understanding how this stuff moves through the environment, ends up in human contact, big area. It was mentioned earlier today, we're up to 50% of our population in urban areas. Urban soils, contamination in urban soils, potential transfer of that contamination into urban-grown food products. Okay? Big area that needs research. Not saying don't go out and grow urban gardens, do urban farming, but we need to understand the situation that we have and how these things work. And then this has also been stated on several occasions that interdisciplinary and transdisciplinary research teams are really, really needed here. There's nobody in this room or on this planet that has the full suite of skills and knowledge that we need to address this topic, this problem. And so we need to find ways to work together on this so that we can bring in all those different sets of knowledge and different sets of skills to address what I think is one of the major issues of our time, just understanding these connections between soils and human health. So on that note, I'll turn it over to the rest of our panel. First up, we have Nick Basta from The Ohio State University, professor in their soil science department there. So all yours, Nick.
Thank you.